Today we are at Tashkent State Dental and Medical Institute, and we have with us Dr. Sharof, who is the Dean for International Medical Faculty. So we'll be asking him a few questions. So let's begin with Dr. Sharof by introducing himself.
Hi everyone, my name is Dr. Sharof. I'm a dean of this foreign faculty. Our faculty study about 400 students from foreign countries. One of them from India. We have 200 students.
Okay.
They study in first and sixth course.
6 years first.
Yes,
Okay.
sixth course. In our faculty, we have two directions. One of them is general medicine.
Okay.
Second is dental stomatology.
Stomatology. So, sir, I'll begin by asking you
Okay.
the first question, which is in the recent times, Uzbek has become a popular destination for general medicine in the past 2 years. So, I would like to know if the general medicine course in Uzbekistan follows all the NMC guidelines. I'm quite sure you might be aware about the NMC guidelines which have come recently in 2021. So, does the 6-year course, which is general medicine course, follows all the NMC guidelines?
Yes. Our general medicine course is we have now before 3 years we have no new course of general medicine. It's international. We have standards of international.
Mm-hmm.
It's Europe and United States standards.
Yeah.
Our education is the same like United States and west part of Europe.
All right.
And one of them, our institute have a 903, seventh rank in the world.
Mm-hmm.
In the world, and our students is now working in Central Asia without exams. Our diploma is give a license for working.
Okay.
Without exams, without anything.
Mm-hmm.
If our students after graduate want to work in Russian Federation, maybe in Belarus, and we have a memorandum with Hungary.
Okay.
Hungary, our students may continue study or working in this country.
Okay. So there will be no additional need for additional
No,
requirements
no.
for equivalency.
All our diploma is enough for him.
All right. We'll move on to the next question, sir.
Okay.
There are a lot of doubts among students and parents with respect to medium of instruction, which is taught here. So, is the entire course, 6 years duration course, taught in fully English medium?
Yes. Thank you. Our question. In our institute, we have study in 3 languages.
Okay.
It's Russian, Uzbek, and third is English course. We have more 400 teachers.
All right.
50% of them they know English very well.
Okay.
Why? Because when our teachers work in our institution, they must have degree, scientific degree. For scientific degree, they must English very well.
Okay. We'll move on to the next question, sir. How many departments and hospitals are associated with TSD?
Our universities have 6 faculties.
Okay.
6 faculties and 41 departments.
Okay.
And we have about 97 hospitals.
Okay. So, in these 97 hospitals, students are being sent
Yes.
to rotations.
They have, for example, if they have subject surgical,
Mm-hmm.
we have a hospital in Republican Hospital. It's a surgery center.
Okay.
They study there. For example, today they have a subject oncology.
Yeah.
We have a memorandum with Republican Center of Oncology. They study there and practice.
Okay.
They working with patients.
Regarding that all 91 hospitals what we have with this college, so all are within the city, or you send students outside the city?
They're all in city.
All in city.
Yes, in the cities. And every hospital, near every hospital, we have metro.
Okay.
Because our students not going by taxi.
Yeah.
Next question is, sir, clinical rotations begin from which year, and are students allowed to touch patients, and because in order to diagnose, it is very important. Yes, it is very important to first take the case history and understand, and for that obviously a little bit of Uzbek or Russian is needed, if I'm not wrong.
In our experience, first year, after the ending of semester, they have a practical month.
Okay.
They go, for example, if the first course study for the first course, they study teaching our sanitary, how is cleaning the departments, how is cleaning rooms.
Okay.
After second and third course, they study nursing system, injections and other things. And after fourth course, they studied like as doctor's assistant.
Okay.
If he interested, for example, if he interested in surgery, he after the lessons, after subjects, if he have free time or she have free time, they go out departments and they go to do the observation. It's not problem.
Yeah.
And about language, yes, every our patients maybe did not speak in Russian, in English, but we try in first and second course more study in our language for our students.
Okay.
You're right, because they must communication with our patients.
Yes.
First and second year they study second language.
Okay.
They choose, for example, they choose Russian or Uzbek language.
Okay, so there is an option given
Yes.
them whether they want to learn.
Yes, for example, our population about 60-70% of them they know English. I'm sorry, Russian.
Okay.
Like us, India, you know English.
Yes.
Your 70% of population you know English.
Yeah.
Our population too. Now in Russian very well, 70-80% of our population.
And Russian also makes it easily accessible to other countries as well. So
Yes.
Russian.
Yes.
Yes.
It's about 500,000 people speaking Russian.
Okay.
So moving on to our next question, NMC, National Medical Commission, has made it compulsory for students who study abroad, to have registration and license to practice, right? To practice in the specific country from where they complete the medical education. So how is the scenario for students who come to study in Uzbekistan?
Thank you. Right now in India is changed rules.
Absolutely.
Our listeners. Till the time for example, in 6 course we prepare for these exams. Like next exam, you name it, we prepare.
Okay.
For example, if they go, we have students from Sudan and Africa. They have rules.
Yeah.
So rules. For example, they have questions of bank of questions. We prepare for these questions for our students.
Okay. So once the student completes his medical program here in Uzbekistan, does the student have the right to practice as a doctor
In Uzbekistan?
Yes.
Probably yes.
So there is no additional exam
No.
to be given. So So the day he graduates, the day in which he gets his diploma or degree, from the next day he is allowed to practice,
Yes.
right?
But yes, he is working as general doctor.
Okay.
If you want to become surgeon, he must study after that.
Okay. So either he can go for residency program or probably
or master degree.
Yes,
master degree, yes. But if he have diploma in our country, he working without problems in there.
Okay.
If he want.
Yeah. And students are registered, like they are included in the council.
Yes.
Proper registration.
We have Uzbekistan total registration.
Okay.
That is soft, and when he get diplomas, for example, if somebody check these diplomas,
Yeah.
we have give information. For example, first course how many hours they study now, how he have mark. It's all in our information basis.
Correct. Moving on.
Yeah. So moving to the general question, like safety is one big concern when the student is traveling to different country. So how safe is Uzbekistan for the students, and especially for the girls?
Thank you. Do you know Uzbekistan is the first rank in safety in the world? I think after the Iceland or in Finland we have second or third place for safety. Uzbek people is very loving guests, very loving guests. For example, if my students is going to street, 10 at the night, it's no problem. For example, our population not dangerous, not not aggressive. They're loving guests. For example, if you go around the street, you may come every home and say, please help me for water or something you need, or turn mobile phone. And our people is not aggressive.
So,
One example for me, when continued the second war, we in our Uzbekistan come about 3 million children. They live in our country. It's for example.
Yeah.
We have one in history. We have one family. He's have 17 children. They from going to after the war. They without parents. They come into there, and this his name. I'm saying Tashkent. He is have 17 children. They nationality Ukraine, Russian, Belarus, Kazakh, and they live together.
Everyone is welcome in Uzbekistan.
Yes, everyone is in Uzbekistan.
Yeah. So before we end the exclusive interview,
I'm sorry, I cannot continue. For example, now is our students, it's foreign students, our students, it's not they friendly. They have give one party, they play in one team in football. They are big friends. We have no difference. It's Indian, it's Uzbek or Russian.
So basically, there is inclusiveness.
Yes.
Everyone is welcome.
Yes, no problem.
So before we end this interview with you, sir, what is the final message you would like to give to prospective students and parents, who want their child to come and study in Tashkent State and Dental and Medical Institute?
What I say, we have rules.
Okay.
When I have a meeting with my students, I say you come to there to study,
Yes, absolutely.
not go to the night clubs.
Yes.
You go to study. Your parents pay for your studies.
Main
Becomes
focus.
good doctors. That till the Saturday, I close our hostel at 10 o'clock.
Okay.
Who coming after 10 o'clock is have meeting with me and explain what happened.
Yeah.
They said in other countries we going to sit at 12 and 1 o'clock. I said no, it's our in Uzbekistan you student, you must come back at 10 o'clock. I control in hostel every day in my wasting go to there how they live, what they do.
Sure.
Not only on our institute, only in our lessons. We have a duty. Our staffs of didn't have duties. Every day they come to and how they are living. For cleaning we stay.
Yeah.
What you do after lessons.
Yes.
They are under control.
So as a doctor, you have to be very dedicated and disciplined, and if they are not taught this during their academic years, probably it will be very difficult for them to continue. So it is really very important.
I speak with the parents of my students. They say it's right because they going to they have many questions. Why we are 25, 23 years old. Why we must come back at 10 o'clock?
Yeah.
Okay. Can I talk with your parents? It's good. It's good.
Yeah.
Because we are Asian peoples.
Yes, absolutely.
We have a same mentality. We must respect our parents. For example, our dad or father said something, we must do it.
Yeah, absolutely.
And what I say for my students, you go to India and it's my face. If you be good doctor, it's good for me.
Yes.
If you not good doctor, you maybe have one patient die. They say, "What's your teachers?" They teach me.
So it is a very big responsibility.
Yes. First time is our till the 2-3 years. We have a quarantine. We have another thing.
Yes, it was the first time, sir.
I speak only Uzbek.
Yeah.
I have no practice in English.
But you're speaking really well in English.
True.
Yeah. Thank you so much, sir, for being so candid talking to our team and Eduwisor, sir. Thank you so much. It was great meeting you, and we'll.
You're welcome.